Hey guys, this is Dr. Hub. Today we are looking at the congenital heart disease and importantly the radiological signs. So first is the very important and the standard, that is a tetralogy of Fallot. The tetralogy of Fallot, the sign is known as the core and support. Next is the TGV. TGV stands for the transposition of the great vessels. So it refers to the egg on the strings appearance. Next is includes the partial anomalous pulmonary venous return. Pulmonary venous return. So we are writing it as PAVR. That is a partial anomalous pulmonary venous return. So under this there is a schemator sign. Schemator sign. Next we move on to the TAPVR. So under the TAPVR, there is a total anomalous pulmonary venous return. So here there is the snowman appearance. This is very significant. That is a snowman sign is seen. Then we look at the endocardial cushion defects. So the endocardial cushion. So endocardial cushion defects. So what does this include? This includes the gooseneck sign. Gooseneck sign. Then comes, we look at the Epstein anomaly. Under Epstein anomaly, it is nothing but a box-shaped heart.